42 hours into the government shutdown for many workers, it is their first day of unpaid work.
Millions of Americans who rely on government help for health coverage are watching this fight in D.C. closely. We start tonight with political reporter Doug Reardon, who's live outside the CDC in Atlanta. And Doug, this shutdown really is about health care.
It really is. Republicans want to cut over $1 trillion in the next 10 years from Medicaid. They also want to get rid of Affordable Care Act tax credits, those subsidies that are set to expire at the end of the year. They say they're too expensive and are being wasted and abused by both Americans and undocumented immigrants. But we talked to people on those subsidies today, and they said they literally may not survive these cuts. And people here at the CDC, they feel helpless to do anything about it.
Work computer completely shut down, my work phone turned off.
For many federal workers, it's been a strange Thursday, their first official day on furlough.
Me in particular, I'm very nervous.
This worker, who spoke to us anonymously over fear of retaliation, is with the CDC and was furloughed for the duration of the shutdown.
If it stretches out beyond a week, then I worry about how am I going to pay my mortgage? How am I going to take care of buying groceries, paying my utilities?
She's also worried about the ripple effects economically.
Daisy girl! Daisy girl!
She's already canceled her dog walker and an appointment with her hairdresser, who both have several other furloughed clients. The gridlock in D.C. ties back to a fight over health care. Republicans want to eliminate Affordable Care Act subsidies set to expire this year that make coverage more affordable.
The ACA subsidies are keeping me alive.
Judy Krebs of rural Lumpkin County is one of over 1 million Georgians who rely on the ACA subsidies. There aren't many options for care in her area, and the subsidies take what would normally be a $900 premium down to $70 a month.
Only my husband's a cancer survivor. My daughter has a chronic illness, and we would have been bankrupt. Literally, I'm not exaggerating, without the ACA. We would have lost our house because that stuff is expensive to treat.
But Georgia congressional Republicans say the ACA, also called Obamacare, has gotten more expensive as lawmakers have chipped away at the program over the years.
The Affordable Care Act needs to be replaced. This is a bad health care system. We need to fix it now.
And the Senate is scheduled to be back on the floor for a vote to reopen the government tomorrow. That short-term resolution would fund the U.S. federal government through November 21st. It does not include those cuts to the Affordable Care Act tax credits. We're outside the CDC. Doug Reardon, Atlanta News First.